Why are pre- and post-vid bladder ultrasounds done? Imagine trying to understand how well your bladder works without any discomfort or invasive procedures. That's where bladder ultrasounds come into play. These tests are essential tools doctors use to evaluate bladder health and function. They are quick, safe, and provide valuable information about how your bladder fills and empties. A pre-void bladder ultrasound is performed before you urinate. It measures how much urine is in your bladder at that moment. This gives doctors a baseline of your bladder's capacity, helping them see if your bladder is filling normally or if it's overdistended, which can happen if your bladder isn't emptying properly. Knowing the volume before urination helps identify issues like bladder overfilling or abnormal bladder capacity. Right after you urinate, a post-void bladder ultrasound is done. This measures the amount of urine left in your bladder, called the residual volume. Normally, your bladder should empty almost completely, leaving only a small amount of residual urine. If the ultrasound shows a significant residual volume, it suggests your bladder isn't emptying fully. This can point to problems like urinary retention, bladder outlet obstruction, or weakened bladder muscles. These ultrasounds use sound waves to create images of your bladder. They are non-invasive, meaning no needles or catheters are involved, which makes them comfortable and safe. Unlike catheterization, which can carry infection risks, ultrasound is a gentle way to gather important information about your bladder's function. Doctors relying on these measurements to diagnose various urinary symptoms such as frequent urination, urgency, incontinence, or recurrent infections. They are also helpful in monitoring conditions like bladder outlet obstruction, which can be caused by an enlarged prostate, or neurogenic bladder, which involves nerve-related bladder problems. It's important to note that while these ultrasounds help assess bladder function, they do not diagnose bladder cancer directly. However, if bladder dysfunction is detected, further testing may be recommended to rule out or confirm other bladder conditions, including cancer. In summary, pre-void ultrasounds tell us how much urine the bladder holds before urination, and post-void ultrasounds show how well the bladder empties. Together, they give a complete picture of bladder health, helping doctors identify issues like urinary retention or muscle weakness. These tests are safe, non-invasive, and play a key role in managing bladder health effectively. Always remember to consult your healthcare provider for personalized advice and diagnosis.